Hello, I'm Dr. Robert T. Rosen. I'm a urologist at Valverde Regional Hospital. Valverde Urologic has a wide array of procedures that we can perform. The hospital has been very good in bringing in top-line, most modern equipment for us to use in performing these procedures in service to the community. Laser prostatectomies, saline transurethral prostatectomies, which is another form of vaporization procedure, incontinence procedures including bladder suspensions, and procedures for overactive bladder. And this is an area where I would like to dwell and discuss. Overactive bladder is probably the most common medical condition in medicine. In the United States, there are 36 million people with overactive bladders. What to do with a patient who is urinating urgently 20 times a day and 5 to 10 times a night? It devastates their lives. It stops their socialization. It interferes with everything they do. They're perpetually bound to the bathroom. If the medicines work, that's fine. But by and large, 70% of them, patients taking these medications will not get a positive response. This leaves us with a new, or not quite new, system of treating this. It's called InterStim, or neuromodulation. This is where we bring the patient in and we lay them on a table, give them some IV sedation, a little local, and we put 2 leads down to what we call the sacral nerve exit. There's no cutting done on the test stimulation. They walk around with a test pack on 2.5 days one side, 2.5 days the other side. If they get a positive response, we bring them back, put them on the table, IV sedation and local, make an incision, put in a permanent lead, and put in, for lack of better words, what you would consider a bladder pacemaker. These are not inside the not inside your abdomen, not inside the bladder. They're just over the skin and the lower part of the back. The batteries in these last approximately 5 years. The patients seldom even know that they have these in after a while. If the battery runs out, you can always make a little incision, pop this out, pop another one in, and they're good for another 5 years. We've been putting these in at Valverde Regional Hospital now for about the last 5 months. The results have been good. We have one patient who was a very alert gentleman with an overactive bladder. We did the test stimulation on him. It was positive. We put this InterStim in the patient. He's totally dry. He voids now approximately 4 times a day, once at night. He's not wearing Pampers. He's out of the nursing home, and he's back home with his wife. And when you stop socializing, it's bad. Dementia can occur, and the patient, on a mentation basis, will decline. We tested these ladies. They both had a positive test stimulation, got an excellent response, and now have complete control of their bladder and are out, about, socializing with the ladies again, and enjoying their lives. The other condition it will work on is non-obstructive urinary retention, where there's no cause for the blockage. The bladder just will not drain completely, and the InterStim is approved for this condition. If you take a look at the number of overactive bladder patients that there are, the need for this is extreme. Medicare pays for this. Private insurance funds this. There are other conditions that occur because of overactive bladders. We cannot calculate exactly how many older patients break their hips when they're getting the urgent call to get to the bathroom and they can't get there on time and they slip and fall. Or the effect of urine loss on skin conditions, skin burns, and breaking down of the skin. So the interstim has a place. They've been in effect been present for about 12 years. They're proven. And we now have this service available at Valverde. The patients have to go through a diagnostic workup period of time where we test their bladders urodynamically. We check their bladders with a scope under local. We try them on some medications, or they've already been on the medications and they don't work. And then we test them for the interstim. So far, our results have been good. Now, it doesn't work 100% of the time, but if the patient has a positive test stimulation, where there's nothing permanently implanted, we're just seeing if it works, they got a 90% chance of having a permanent good result with the implant of the interstim. The only thing that an interstim patient cannot have is an MRI because it's a metal inside the body. So no MRIs if you have the interstim. But it is a game changer, it's a life changer. It gives people their lives back. And patients are saying to us, thank you for giving me our life back.